With so many kids playing so many sports outside nowadays, parents have been asking for my aid, first aid, in regard to how many of their kids' cuts and bruises really need to be taken to their healthcare provider. Well, let me see if I can provide some information and bandage up everyone's concerns. It turns out that the vast majority of home cuts and bruises really don't need medical attention if you know what to do for them at home. That begins by cleaning out the cut really, really well, running it under water, hopefully water under a little bit of pressure, such as from a sink hose, to get the dirt, debris out of that cut so there's no risk of infection. Once you've done that for 3 to 5 minutes, then you want to pat the wound clean with a sterile dry gauze and then apply a bandage over the wound and the skin around the wound so it's nice and clean. So when do we worry about a wound or a cut that needs medical attention? Well, if you find yourself using gauze pad after gauze pad after gauze pad, or the bleeding continues for 15 minutes, that's a concern. If you think the edges of the cut are so wide they're not going to close without a significant scar, seek medical attention. If the cut on your child is on their lip and it goes onto their face, well, you also probably want to take your child to the emergency department to get some stitches so there's not an unsightly scar. If the cut has occurred because of an animal bite or scratch, talk to your child's healthcare provider because it may be that antibiotics need to be prescribed. Also, if the wound that you've bandaged starts to turn red or ooze some pus after a day or two, again, seek some medical attention for those antibiotics. And don't forget to ask whether your child's tetanus immunization status is up to date after your child has experienced a cut. Of course, the best way to prevent cuts and bruises from occurring is to safety-proof your home. And the best way to do that is talk to your healthcare provider, or you can watch First with Kids every week because I provide a lot of safety tips as well. So that hopefully tips like this will take you to the cutting edge and won't hurt a bit when it comes to helping your child deal with his or her cuts and bruises. This is pediatrician Dr. Lewis First from Vermont Children's Hospital of Fletcher, reminding you to always be first with your kids.